Hi everyone. I want to speak directly to two groups of people that are the caregivers and the caretakers. I want to say a few things to them, even though I understand their job and how there is distinctive variations between what they do. I also know that when it has to do with taking care of persons living with sickle cell, it's almost the same thing that they do. Okay, I want to talk to you directly or speak to you directly about a few things. The first thing is just understand the condition. Edu- just educate yourself about what sickle cell is, right? And through that, you'll be able to understand the symptoms and the complications that comes along with it. Let me just give you an example. My experiences with sickle cell, back then I used to go to a website like a medical website like Mayo Clinic, and I get a lot of information from there, as well as other places. So for me, I can use that as a background. So you go to a reputable site, you read about it, ask a few questions, you get feedbacks. You can even go to a reputable places that they can show you medical videos of persons living with sickle cell. Just understand it so you'll be able to know what you're doing. From that, you can join associations, associations or support groups. When you join these associations, you speak to other families that have persons living with sickle cell. So then you share ideas or you share, what is it called, experiences. You learn about other conditions and what they were able to do. Because this is what you have to understand. The cases are not the cases are not the same. The cases are not the same. The conditions and crises that we may have are all unique. So what I may be going through may be it may differ from like the next person. So you just have to learn all this from these people. Another point is you speak to medical practitioners, whether they are doctors, whether they are nurses. You speak with them, you ask questions. That's how you're going to know. Asking questions. I have a few doctors here, even on this platform, that I bother them with questions and I get feedback from them. That's how I'm able to learn. You ask questions from the doctors, the nurses, and they give you the feedback, and then you grow on it, on that knowledge. Another point is, after joining these groups, you go through symposiums. So there are sickle cell symposiums. They may hold meetings. A group of people. You join, you go in there, learn what you can from these places, so that you'll be able to understand a bit more. Another point is also whoever you are taking care of, that person that is going through all the conditions, you have to understand him or her. Ask them questions, what their pain, what their pains are, how can you do to help them, what the pain management is. They're the ones that are going through it. They'll be able to tell you that maybe this or that. You just have to understand what they say, so you'll be able to implement what you think is right. And if you think or if you feel they are going through something that is worse or that is beyond, then you bring in a medical team, or you take them to the hospital. If you think it's severe, then that's where you look at. Yes. And what else? Yes. And I think lastly, just seek medical help for the person when it's beyond you, when you can't do anything to calm them down or to manage their pain. Just seek medical help. Yes, I think this is fine. Thank you very much. Bye.